Well, hey everybody, this is Robert and welcome to Outbreak News TV. And before we get into the news report, I just want to remind you to subscribe to the channel if you like this video or like others, comment below and share with your friends. Let's go ahead and get started. And today we're going to go ahead and take a look at the Marburg Virus Disease outbreak in Ethiopia that we learned about late this past week. Now, Ethiopia is in Eastern Africa, and just so you understand the geography, it's located on the Horn of Africa at the far eastern side of the continent. Now, on November 12th, the Ethiopian Ministry of Health, along with regional health agencies, reported investigating an outbreak of viral hemorrhagic fever in the town of Jinka in the South Ethiopian region. The Minister of Health at the time said 8 people had been identified as suspected cases of a yet unknown etiological agent. Well, a couple days later, viral hemorrhagic fevers. What did they have to rule out? Well, in Africa, there are many types of viral hemorrhagic fevers, including Marburg and its cousin Ebola, Crimean Congo hemorrhagic fever, Rift Valley fever, which we're seeing that large outbreak on the west coast of Africa, in Senegal and that area. Lassa fever, we see hundreds of cases in Nigeria every year. And yellow fever, these are some examples of viral hemorrhagic fevers. The location of this outbreak is the South Ethiopian region. Ethiopia has 12 regions, and the South Ethiopia region is in the sort of southwest part of the country, and I have that pointed to on the map. Anyway, as I was saying, 2 days later, on November 14th, the Ethiopia Ministry of Health reported following laboratory analysis, they confirmed the outbreak to be caused by Marburg Virus Disease. Now, the World Health Organization in Africa Regional Director, Professor Mohammed Janabi, said that WHO and its partners will continue to work under the leadership of national authorities to strengthen response measures to bring the outbreak under control as soon as possible. Then later in the day on Friday, the World Health Organization in Ethiopia published this news release, and it says that the Ministry of Health had confirmed the outbreak of Marburg virus disease in the South Ethiopia region. This is the first of its kind in the country. Genetic analysis by the Public Health Institute revealed the virus to be the same Marburg virus strain as the one that has been reported in previous outbreaks in other countries in East Africa. To date, as of Friday, a total of 9 cases have been reported in the outbreak that affected the town of Jinka in the region. And national authorities are scaling up response, including community-wide screening, isolation of cases, treatment, contact tracing, and public awareness campaigns to curb the spread of Marburg. All right. A little bit about Marburg virus disease. As I said, it's the cousin of Ebola, so it's got a pretty high case fatality rate. On average, it's about 50%, but you can see it as high as 88. So 88 out of every 100 people that catch Marburg in very, very severe cases will die. But it can be much lower with good care and early patient care. Though it's caused by a different virus, Ebola and Marburg diseases are clinically similar. Both diseases are rare, but have the capacity to cause outbreaks with high fatality rates. Marburg virus disease was initially detected in 1967 after 2 simultaneous outbreaks in Marburg and Frankfurt, Germany, and Belgrade, Serbia. These outbreaks were associated with laboratory work using African green monkeys imported from Uganda. Previous outbreaks and sporadic cases have been reported in Angola, the DRC, Ghana, Kenya, Equatorial Guinea, Rwanda, South Africa, Tanzania, and Uganda. The disease is transmitted to humans from fruit bats and spread among people by direct contact with body fluids of infected individuals or contaminated materials. People cannot transmit the disease before they have had symptoms and remain infectious as long as their blood contained the virus. Now, the incubation period, which is the time between infection and the actual onset of symptoms, varies from 2 to 21 days. Marburg begins abruptly with a high fever, headache, malaise, muscle aches, pains. You can have watery diarrhea, abdominal pain, cramping, nausea, vomiting, which can begin around the 3rd day. A rash can be present. From day 5 of the disease, patients may develop hemorrhagic manifestations, including blood in the vomit and feces, bleeding from the nose, gums, and vagina. So some very serious symptoms that can be present. In fatal cases, death occurs most often between 8 and 9 days after symptom onset, usually preceded by severe blood loss and shock. Anyway, so that's what's going on in Ethiopia right now, and it appears like they got a pretty good handle on it. We haven't heard any reports of fatalities as of this report, and it sounds like the containment and other methods that they're doing is working reasonably well. We'll learn more in the days to come. But again, we'll be keeping an eye on what's going on in Ethiopia. You can also follow the Substack, outbreaknewstoday.substack.com, for continuing coverage on this outbreak and many others. And I'll see you next time on Outbreak News TV. Thanks for watching.